Mental health problems are among employees, and this may have cost the country 14.46 billion ringgit or 1% of Malaysia's gross domestic product (GDP) in 2018. Such issues had been on the rise, with 29% of the population suffering from it in 2015 compared to 10.5% about 10 years earlier. Even worse, a majority of companies do not know how to deal with employees facing mental health issues. Salina Zakaria has the details.
Mental health conditions are often referred to as invisible illnesses, but they are very heavy costs to an individual health, to family and also friends, and to even organizations. Yet, most Malaysians do not think of a mental health condition as genuine as health issues. They do not recognize that persistent feelings of low mood or persistent disappropriate worry of a number of different events are the symptoms of the mental health conditions. A white paper released by Relate Mental Health Malaysia titled Workplace Mental Health, the Business Cost revealed 53% of working Malaysians experience high work-related stress. Some symptoms for mental health disorder could be headache, fatigue and body ache. With 29% of Malaysians in the labour force aged between 15 to 65 experiencing poor mental health, such as depressions and anxiety, it is apparent that the costs are tangible and significant to every organisation. The affected employees' condition could also lead to absenteeism, working while unwell and high staff turnover, which in turn brings loss of productivity and higher business costs. In spite of the high economic impact, less than 1% of the country's annual health budget is allocated to treat mental health issues. To address this, human resource managers need to be able to identify employees with such problems, such as their medical leave patterns, and provide aid for them before it is too late.
But when it comes to MC pattern, MC pattern has its own, suspicious pattern if you look at, on a general basis, meaning that if we can see that the pattern has been consistent for the last, for example, like 3 months, then any HR basically who feeling that this is a potential fake MCs, I would say that non-genuine MC, so they should seek further, assistance from the professional themselves, which is in this case, it can be an occupational health doctor.
I think mental health screening is really helpful, but again, I want to emphasize it's not diagnostic in any way. So mental health screening can't just be put out there and without any follow through. Mental health screening is good when it's put in the proper system where there's actually follow-up care.
According to Deputy Women, Family and Community Development Minister Hannah Yeoh, her ministry also had received 6,107 mental health cases, with a majority requesting for counselling.
A working mother today has different set of challenges than 30 years ago. So if you don't move it with time, you are going to be left behind, and you will realize that, today people emphasize a lot about quality of life, work-life balance, and so even though you may offer the highest salary in your industry, but you will find young people may not take it up.
There are also many studies on the benefits of investing in educational programs to improve mental health literacy, as well as offering confidential workplace mental health support. The World Health Organization also estimates that investing a cost of 4 ringgit per year for effective treatment of anxiety and depressions alone will increase productive workdays by 10%. Salina Zakaria for 7 Edition.